On September 27th, Wisconsin's Department of Health Services announced who is eligible for a COVID booster shot. The department says if you are at particularly high risk of getting COVID-19 and you've had 2 doses of the Pfizer vaccine already, you are eligible for the Pfizer booster shot. Now, the department says a booster is just an extra dose, a supplemental dose of the vaccine, since the protection may fade over time for some populations. The booster dose is just intended to boost your immune system for a better, longer-lasting response to viruses like COVID-19. Now, the department says there are some populations who should seriously consider getting the booster shot, and they say it's these people. If you've gotten your 2 doses of Pfizer, and you're either age 65 and older, or you're a resident in a long-term care facility, or maybe you're age 50 to 64, but you have an underlying health condition, then you should consider a booster dose. And the department actually gives examples of underlying health conditions, and we link to their list in the description below. The department went as far as to tell us that there are some populations that just may want to get the booster vaccine. And these are also people who already received the Pfizer original doses and are either age 18 to 49 with underlying medical conditions. You may want to get the booster. Maybe you're at increased risk because of where you work. You have exposure to people that have COVID in your work environment. And that might be someone like a first responder or someone that works in a school environment. The department actually also gives us some examples of people whose work environment may encourage them to get a booster shot. Now, what about other vaccine types? Because we've been talking about Pfizer this whole time. The department says at this time, the Pfizer booster authorization only applies to people whose primary series, their first 2 shots, was the Pfizer vaccine. People in the recommended groups, like underlying health conditions or at work exposure, if you got Moderna and Johnson Johnson, we will likely need a booster in the future. We think, says the department, we're going to be getting more data on Moderna and Johnson Johnson and whether booster shots will get emergency use authorization in the very near future. Now, if you are still looking for an original series of vaccines, you can find it on vaccines.gov. You can also read the Department of Health Services announcement that we referenced today. You can also, like we said, read more on underlying medical conditions and work environments that might be particularly risky. You can also read the FDA Approval Statement on booster shots for Pfizer. We link to that in the description below.